My name is Kim Prince. I'm a cardiac sonographer. I've been performing cardiac scans for over 16 years now. I've seen a lot of students come through. I've trained a lot of students. I'm also an examiner for QT and tutoring for CQU and ASM for many years. So I've seen a lot of students come through. I've also seen a lot of things that they do wrong with posture. I'm a big advocate for making sure we're doing everything we can to avoid possible pain and injury as a sonographer. So I'll chat with you about a few different things that we can do to prevent that. So a lot of students probably wouldn't even realise how physically and mentally demanding a career the sonography is. And with the rise in, the population with obesity and even more people having heart disease, meaning more patients, we're getting more and more people coming through and more difficult patients coming through. So it's even more physically taxing on us. So therefore it's really important for us to look after our physical as well as our mental well-being. Not just talking about in work hours, but there are things you can do outside of the workplace to help have a long and happy career. So, first things first, before we even start the scan, we want to do a few things. Being prepared is a big one. So, by being prepared, I mean have everything ready and close by. You don't want to be reaching too far for things, so for your gel, electrodes, wipes, etc. Make sure you've got all your correct probes in handy position. Make sure you're well rested and that you eat and stay well hydrated during the day. A tired and hungry sonographer tends to lead to sloppiness both in posture and technique. You can decline your image quality as well. You can also risk missing any important pathologies and things. So making sure we're sort of well rested is a really good idea. I also encourage sonographers to keep active and healthy outside of work hours. So I'm not talking being an elite athlete or anything, but just, it does set a good example as well to our patients. But to maintain your physical and mental well-being will help you have a long and healthy career and reduce any injury that could possibly occur. You've got, it helps us also get through the day. As I said, this is a taxing job. So if anything we can do to help us get through the day is a benefit to both us and the patient, of course. Have breaks during the day, even if they're just small breaks, such as get up and walk out of the room between patients, go to the bathroom, grab a drink of water, do some stretches quickly between patients. I do recommend that you do stretches at least once a day, but especially after even more taxing patients. So really difficult patients where you're really having to lean or in intensive care where we're in all sorts of obtuse angles. So do them more if you've had a big day of really difficult scans. I'll also touch on this a bit later on in this presentation. So let's get ourselves set up. So the room to start with, we want to make sure everything's ergonomically friendly. So your machine and your bed and chair. So the machine should be able to have a keyboard that comes out, twists around, a screen that twists around, things that move up and down. Ensure that your bed and your chair can have adjustable heights. It doesn't have to be foot pedal, just any pedal that can adjust the bed height. A cardiac cutout is an advantage but not an essential thing for the bed. And also with the chairs, some people have recommended saddle chairs. I don't find, in my personal opinion, that these have worked for me particularly well because I find I can't get close enough to the patient, and which means I'm leaning and things. So for me, it's not ideal. But I also like a little bit of a backrest in supporting my lumbar spine when I'm scanning. So now that we've got our room all set up and everything close by, what are we going to do as sonographers to help ourselves? So we want to make sure that our posture is correct. Doesn't matter if you're standing or sitting or whether you're left or right-handed. Everything should be neutral and above each other. So straight back, head above your shoulders, above your knees. Avoid twisting and flexing of the spine. If you need to sit on the edge of the bed, I do encourage not to do this because you've got more twisting motion of the spine. If you need to, try and minimize this, or even try and pull yourself around a little bit so that you're still facing the front of the machine, rather than hips facing one way and your face facing the other way. So an example is in the poster from ASA. You can get these from ASA online. So now that we've got ourselves set up, let's get our patient in prime position for us. So as I mentioned, they should be up nice and close to you at the edge of the bed, with their left arm up under the pillow or up under their ear. This opens up the rib cage so we can get in nicely. If they've got shoulder injuries, which you will find with cardiac, for some reason you'll notice a lot of people have left shoulder injuries for sure. Just put a slight bend or straighten the elbow. It eases some of that pressure. Pop the arm on a diagonal. It doesn't have to be right up above the head. Just pop it out away from the body a bit. Make sure the bed is up to an optimal height, especially so for lefties, so you're not flexing the shoulder too much or flexing your wrist, bending your wrist too much. And for right-hand scanners as well, so that you're not leaning over the patient. You want to rest comfortably with your arm, just resting on their body, nice and comfortably. And of course, you've already adjusted your chair height. So, of course, sometimes there may be a bit of a surprise with a dextrocardia or something if it's unknown. Usually, hopefully, the cardiologist will tell us about this, but you may need to change your patient setup a bit. So for dextrocardia, situs inversus, you may need to just change them to their right side. Otherwise, you'd be sort of floundering around in the dark for a heart that is on the other side. Alright, so one last thing before we actually start the scan. We've got everything set up nicely. You want to make sure your ECG capture is going to be pristine. Remember, your doctors are going off your image captures for their diagnosis, but also if you've got a really a big trace full of artifacts, messy, whatever, it's going to cause a lot of havoc throughout your scan. You're going to get frustrated, you're going to be there longer. So make sure you've got a nice clean trace for capture. Check your rhythm as well. If you're in IAF or by Gemini, you may need to increase your cycle length to a minimum of 3 beats, which you're going to need to measure anyway. So have a look at your leads, maybe replace your electrodes, change your lead placement a little bit on the chest. You may even need to abrade the skin if they've got elderly flaky skin. And just check your clip before you actually accept the full clip to make sure that it is 2 cycles. So this is just an example of a nice clean ECG, really good for capturing, and below it's just an example of a trace that's got a lot of artifact in it. Again, if you've got a low voltage AF, you can sort of replicate these sorts of artifacts, and the machine will have trouble capturing with the QRS. So if you've got that problem, you can change your cycle length and capture time in the study. You don't have to set it just from the start. You can change it throughout the study. So visit some different websites to get ideas on other stretches and things you can do in the workplace and even out of the workplace for injury prevention as a sonographer. This is another poster from ASA. I've also looked on the occupational health and safety websites, government websites, ASE guidelines, ASM. So just utilise those sorts of resources. Anything we can do to help improve our flexion and mobility throughout our body means that we're more fit to perform the scans, and we've got less of a chance of having a recurring injury or getting pain and knots throughout our studies. So as I said, I'd recommend doing those stretches at least once a day, even before you start your scans for the morning or for the afternoon, whatever your shift. And when you've got more complex studies and you're feeling a bit sore, I'd probably do them more routinely, especially if you've got quite a lot of portable bedside patients that day. Because it's not just about the amount of studies you perform. You could do 10 perfectly normal, easy studies and not feel a twinge. and then you do that one intensive care or bedside patient, and you've got all your joints in all these sorts of obtuse angles, and really feeling it afterwards. So just do those stretches. It's, as I said, it's not about the amount of studies necessarily, but about your form, your technique, how the complexity of the scan, the length of the study, and also the mobility of the patient. Are they able to do the things you're asking? You know, a lot of elderly patients, which we have, can't lie on their left side or take their time getting on the bed. So it's all dependent on those sorts of factors. It's not going to be 100% of the time avoidable, so we want to try and avoid it wherever we can. Just be as friendly, as comfortable and ergonomically friendly as you can for the study that you're performing, and adjust accordingly. Do your stretches, keep well hydrated, go for walks during the day. All of this to avoid pain and injury. Sometimes, as I said, unavoidable, but we want to try and avoid it as much as possible. Get treatment when necessary if you have got some injuries, and also report those injuries if they have occurred in the workplace. I've used from the ASA and the Occupational Health and Safety. Lots of other websites out there that you can use, resources that you can use for prevention of pain and injury. Look up different exercises that you may want to use, create some exercises yourself, also do some warm-up things before you start your day. I've just created a little short YouTube video, which I've got the link on the next slide, just to show some of the accessories that we have in our lab, to, you know, a little pocket physio to work out knots in the neck, or a TheraBand to help activate some of the muscles before we even start our day. And this is just the link to that little YouTube video that I've done. Not demonstrating any exercise, but just showing you what other accessories we've got in our lab. But we'll be interested to hear in any other exercises you've got, or any other feedback about this topic. Thank you very much.